been a patient with vascular issues for many, many years, and the early part of that felt like I was being treated for the symptoms rather than as a person. And progressively, I met with clinicians who understood what impact it was having on my life. And they started talking to me as a person and looking at what outcomes I wanted and what mattered to me. And that was an absolute changing point.
I think that patient-reported outcomes are essential to really determining quality of life and desired outcomes for the patient. Patient outcomes measures are trusted and used globally. It's similar to registries. Patient-reported measures should actually be the gold standard of determining whether a treatment met the patient's desired outcome. They also offer an opportunity for healthcare providers worldwide to communicate on best practices and collaborate. Because in the end, all that matters is the patient. If we are not treating the patient needs and improving their life, then how could we know with certainty that our traditional scientific methods can be trusted if patient-reported outcomes are excluded?
ICHOM has impressed me in the way that it involves people with the conditions in the process. So there has been a real parity between the expertise brought by clinicians and the expertise by experience brought by people with the condition and parents of children with the condition. And we've all been fully involved in the process.
The biggest challenge in value-based healthcare, at least in the United States, is really on the payer side. Billing and claims administration continue to be major barriers to implementing value-based healthcare in the U.S. Our payers have substantial investments in technology, and that technology was built for traditional billing and payment methodology.
And the biggest challenge is to add value and even more value for those in most need. So those with the poorest access to resources for treatment and care, but also those with the poorest states of health, they need even more support.
Before I worked with ICHOM, I had no understanding of what it could be and no expectations, but it's really impressed me in a number of ways. The opportunity to be involved in developing patient-centered outcome measures is in itself incredibly helpful, incredibly positive, and a sense of value in what I've been through. But actually the process within ICHOM is fairly remarkable. It equalises the voices between clinicians and patients. So when I've been involved in these working groups, I have never ever felt like I was there as a token effort. I've never felt that I was there just to tick a box. I've been central to it. The teams have involved me, not only in the meetings, but with extra meetings alongside to make sure I understand things, and communicated constantly as to what's been done with the working group decisions and where we go. But not only that, being involved in the papers, being involved in the outputs really is a testament to how the ICHOM process not only involves the patients, but centres them. One of the things that for me marks out why the ICHOM sets of measures are so trusted and so credible is the transparency of the process and the level of inclusion of patients. I've seen in my professional life lots of things that suggest they're patient-centered and patient-involved, but actually they don't feel very equal. The ICHOM measures are built on a real partnership. So what comes out of that process, those sets of measures reflect what matters to clinicians and what matters to patients, integrated in a way that can actually be used. So they are, for me, one of the most credible, trustworthy and comprehensive sets you can have.